Folk, who oversees the administrative wing of our department. Dr. Sharon sends his greetings. He couldn't be here because of conflicts. Same with Mimi McKay, but I think I'm planned to be an ongoing presence at this group, so hopefully there'll be some continuity. So the first question that always comes up in this overview is what's happening with the reorganization of our department, and I can tell you that we've been continuing to get input from the trenches about what makes sense. We've moved from having age group specific bureaus to having divisions that are intentional around different types of care that we deliver, from intensive services to outpatient services to mobile services and outreach and emergency services, and also prevention services. So those alignments continue. People are now doing double duty in some cases because they can't hand off their old jobs until the people who are taking on their old positions get reassigned. But more reassignment letters are going out on a weekly basis. The most recent were to members of the pharmacy staff, which will now be aligned under the discipline chief of psychiatry. We'll introduce you to in a moment. One other change is that the Promotoris program, which I think is very important given some of the issues that have already come up with cultural specificity, there's been a directive that the Promotoris program, which is in the past focused mostly on the Spanish-speaking community, needs to also focus on other communities that are underrepresented as well. Ana Suarez oversees that, and it was kind of on the most recent versions of the org chart attached to the administrative bureau. But I view that as a prevention program because the promotors, what they do, they reach out to people who are in the community who have connection to those communities, like the woman earlier was talking about, who are on Skid Row, who are in the places where people may not speak the same language or may have cultural byways that people don't understand. So the Promotores program should not just be for those who are Spanish speaking, even though its name might imply that.
That's right.
The other components that are changing, we're now using the term division. In the outpatient division, we submitted a request to the CEO, that's the county budget office for the most part. They oversee what decisions we make. They felt that because that division was so large, it's currently being overseen by a woman who many of you know, Carlotta Shaw-Siegel, that it was so large that it required not just one senior deputy and a junior deputy, but rather one senior deputy and 3 junior deputies. We were all prepared and wrote up duty statements for those 3 positions. One would oversee half of the geography of LA, another would oversee the other half of the geography, and a third would oversee countywide programs, things like CalWorks and others. But we got response back from the CEO's office that there were too many levels of unrepresented employees in this group. So back to the drawing board. So we sometimes get mixed messages from the bureaucracy as well. But we're plowing forward, and we're still trying to identify good candidates to fill those positions once we get clarified what their reporting lines will be. As I mentioned a moment ago, there are the arrivals of new staff members. In particular, Dr. Sharon has been working hard to get a diverse team that reflects the county. I'm part of that. He announced just by email a moment ago the new peer chief who will be joining us in August. Her name is Kiris Jan Myrick. She's been in LA. Thanks. I made a clandestine trip to DC and happened to meet with my friend Kiris a while back and tried to encourage her to consider the opportunity, which I'm happy to hear that she did.
Dr. Bonds, could you repeat her name a little slower and you can get the spelling too?
The spelling is tricky, but it's Kiris, spelled with a K. I think it's Kyris, Jan Myrick. And I can get you the actual spelling for that, and I'll forward the email. Another discipline chief who's been appointed is not new to the department, Yvette Wilk, who's overseeing social support services, which includes social work and MFTs. And right over here to my left is Dr. David Ruskin, who just joined us as the chief of psychiatry. Dr. Ruskin comes to us from the Portland Puget Sound VA, I'm sorry, Seattle Puget Sound VA. Do you want to come introduce yourself?
So yes, I'm David Ruskin. I'm really happy to be here with all of you, and I'm looking forward to meeting you and working with you. And I intend to participate in these meetings as much as possible, hopefully every single time. So this is the kind of venue that I love. I like to hear complaints, concerns right off the bat, and I love to solve them for you. That's my goal. Our first step here is to fill our vacant positions that we have, because we're all about access. We can't provide access to the community unless we have our positions filled, so that's going to be my first priority. We have a number of ways to do that, through telehealth, through incentives, and through providing overtime for our psychiatrists. So I really think we're going to be able to fill these positions relatively quickly and increase our access to the community. Our goal is to be able to make things as easy as possible for people to come in, one-stop shop, and reduce barriers to care. And anybody who comes in, we need to help them right then and there. We need to take responsibility, and that's really our goal. So it takes people a lot of effort to get off the streets and go for help. And once they do, we certainly don't want to lose them at that point in time. So that's our philosophy. That's the philosophy of Dr. Sharon, and we all appreciate his vision. I think you're going to see great things. But thank you. It's nice meeting you.
Where are you from, and what did you do in your past?
My apologies. I am from, well, actually, I'm from Los Angeles.
Okay.
So I've worked in county facilities most of my career, mostly directing psychiatric emergency rooms. So I know how the county works, and I know the kind of, this is my patient population. These are the people I like to serve. I actually went to Seattle for 4 years, and I was the director of mental health at that program. So spanning 7 different facilities. So, but I came back here because I wanted to be in Los Angeles. It's my peeps, and I really wanted to help this population. This is really where my passion is. So, really happy to be here.
Thank you.
Thank you, guys.
Sorry for the interruption.
Thank you, Dr. Ruskin. Nobody's happier to see him here than me.